Today, as we grapple against the COVID-19 pandemic, it is even more important to make the connection between health, climate and the environment. We humans have transformed the majority of the world's ecosystems, destroying, degrading and fragmenting terrestrial, marine and other aquatic habitats and undermining the services they provide. Enhancing environmental health through better air quality, water and sanitation, waste management, along with efforts to safeguard biodiversity, will probably reduce the vulnerability of communities to pandemics and thus improve overall societal well-being and resilience.
Today's COVID-19 global crisis is a stark reminder of the complex links between the transmission of infectious diseases and biodiversity. Biodiversity loss is associated with the transmission of a range of pathogens, while land conversion and wildlife trade bring more people into contact with potentially new diseases.
We're hearing this term, zoonotic diseases. A zoonotic disease is an animal infection that's transmissible to humans that causes the disease in the humans. Could be a virus, could be a bacterium, could be a fungus or some other kind of an infectious agent. Whatever it is, when it passes from its non-human host into its first human, that event is called spillover, which is why my book is titled Spillover. If it spreads through a dozen or 2 dozen humans, we call that an outbreak. Maybe the outbreak can be controlled. If it's not controlled, if the virus or whatever is very transmissible and it spreads through a whole country, you've got an epidemic. If it makes it to an airport and spreads around the world, we have a pandemic, which is what we have now. All of these zoonotic diseases account for 60% of human infectious diseases. So this is not some obscure thing off at the fringe of medicine. This is central to human public health.
Scientists estimate that zoonotic diseases account for 3/4 of new or emerging diseases in humans. Many deadly pathogens in recent memory, Ebola, HIV, dengue, SARS, MERS, Zika, West Nile, have taken this interspecies leap.
At the end of the day, human and animal and environmental health are one and the same. And that must be the learning that we take away from this terrible pandemic of COVID-19 and the tragic suffering that we're seeing around the world, including in India, of course. As we degrade the natural world, we're chipping away at the very foundations of what makes well-being possible. That means our food, our water, the temperature regulations, economic growth, the roofs over our heads, the clothes we wear, all of that is provided by nature. So the pandemic has shown us that we really need to rethink our relationship with nature.
While the origins of SARS-CoV-2 is yet to be fully established, it is clear that overexploitation of habitats and wildlife trade can play an important role in disease propagation, and it is important to recognize how important it is to protect the ecosystem, to protect ourselves.